All right, well, good afternoon, everyone, and welcome to today's session on ESG and COC cost eligibility for rapid rehousing. We're going to do some introductions in just a moment, just a couple of quick logistics for the call. Today's session, as you can tell, is on Microsoft Teams. You do have the ability to come off mute to ask questions. Please be mindful of that, though, and if you're not a person who's asking a question or talking, to stay on mute, just so that we can reduce the amount of background noise that we hear. You can also use the chat to submit questions as well. I'll be monitoring that, and folks from MDHA will be as well. So the slides and this recording will be shared with MDHA afterward, and then they can distribute to folks who would like the recording. Just wanted to thank folks from the COC for inviting us here today. We really appreciate the opportunity to meet with you all and talk about some best practices in rapid rehousing and some of the really important regulatory pieces that are important as providers. If you wouldn't mind, please introduce yourself in the chat window now. I'm going to get that blue screen off so that I don't look like I'm from Willy Wonka anymore. So if you could please introduce yourself with your name, with your pronouns, your agency affiliation, and feel free to continue to use the chat throughout the session today. My name is Greg Barchuk. My pronouns are he and him. I'm a HUD TA provider with ICF. I'm also the regional coordinator for Region 6 and TA point of contact for Dallas and some of the other communities in Texas and in New Mexico. I'm joined by two other of my teammates from ICF. And Sarah, would you like to introduce yourself?
Sure. Hi, everyone. My name is Sarah Pagney. I use she, her pronouns. I am a TA provider with ICF, and I am based out of Philadelphia, Pennsylvania.
Should I go next? Hey, y'all. My name is Ben Cattell-Knoll. I'm also a TA provider with ICF. I am not part of the Region 6 team, but I am part of regional teams in the Northeast. I also am based out of Pennsylvania, and prior to doing TA work, spent a number of years as a rapid rehousing provider. So that's kind of what brings me here today, and I'll share a little bit about some stuff on sort of the program side of rapid rehousing and how we put, something behind these regulations and how we actually make them show up in the world.
And I failed to
he, him. Sorry, I didn't say that.
Thanks, Ben and Sarah. And I failed to mention that I'm also from Pennsylvania, so you're getting an entire Pennsylvania contingent today to come talk with you, mostly by coincidence, but that's sort of just how it shakes out sometimes. Thanks, everyone. For today's agenda, we're going to cover some background on equity and in rapid rehousing before moving on to costs for ESG and COC programs. We'll discuss rent reasonableness, utility allowances, and utility assistance before closing with some information about inspections and other resources. Before we begin, I wanted to mention a little bit about regional teams. We've mentioned that phrase a couple of times. Wanted to talk to you a little bit about what that means. Most of the audience today here are rapid rehousing providers, and so you may not really be familiar with the Regional Teams Initiative. It's something that's usually provided by HUD to COCs and to ESG recipients. And so we just wanted to talk a little bit about what that is. Regional Teams is a HUD initiative to provide some form of TA to every COC in the country. And so all COCs are grouped into 10 regions. Each region is assigned a HUD TA as their point of contact. And those teams are coordinated by someone who's a regional coordinator, whose role is to really set the agenda for the region, to work with the field offices on ways that we can collaborate, and to assist the points of contact in TA requests and things like that. Some of the goals include providing current information to COCs, as you work to end homelessness, maintaining open lines of communication to help respond to issues as they emerge, and facilitate two-way learning. So regional teams is one of the ways that we learn about what's going on in communities, again, all over the country. And we can then provide that feedback to HUD, which helps shape future guidance and best practices. So for folks who work in housing, though, it's important as well to keep in mind the historical and current inequities in our system as well. Not confronting those issues means that they continue to exist. And so we recognize that the COVID-19 pandemic has amplified the historic and current racial biases and discrimination that's embedded in all of our systems, processes, and our practices. We also recognize that most people who are most detrimentally impacted by COVID, by housing instability and homelessness, include racial minorities, folks who are elderly, and those who have health problems, especially respiratory problems. COVID has also had, as we all know, significant economic impact on our communities, including job loss, housing instability, increased risk of homelessness, and that those impacts are most likely to affect certain racial groups, especially folks who are Black and Indigenous. One of the things that makes me excited to be here today is that rapid rehousing is really well positioned to help address those inequities in our system, as well as address housing instability and homelessness for all people who are, in our communities. And so it's one of the primary ways that we can provide safe places for folks to live in our community. The Region 6 TA team is here to support those efforts. One of the ways that we do that is through trainings like this. And if you're interested in more information on HUD's perspective on racial equity and racial disparities, there's a link on the bottom of the slide here to the racial equity page on the HUD Exchange. You'll be able to click that link when we send out the PDF of the slides after the session. And so for more on rapid rehousing and homelessness, I'd like to hand things over to Ben.
Thanks, Greg. Sorry, it takes a second for me to unmute here. My computer's real laggy today. So just wanted to sort of start at the most basic level with what we know about homelessness. And I think I am not intending to tell you all anything you don't know in this slide or spend a lot of time with it. But I think, if we are here with the goal of ending homelessness, and that's what we're trying to do, and that's what the problem we're trying to solve with rapid rehousing, there's a lot of ideas out there about why people become homeless, what's needed to end homelessness. And I think it's just really important that we start on the same page because we can't effectively solve for a problem that we don't have a shared agreement, about the nature of the problem. So, just wanted to sort of start with this foundational shared understanding that homelessness is, a social problem that's the direct result of somebody having a housing crisis, typically teed off by a financial crisis or some other kind of crisis that sort of takes what has been maybe up to this point a very precarious housing situation, an unstable housing situation, and sort of blows that up so that the person ends up literally with nowhere else to go. So to that point, most people experiencing homelessness are not significantly different from other folks who are poor and living in poverty, with the exception, I think, of, as Greg pointed out, that there are tremendous racial disparities in who experiences homelessness above and beyond sort of what you would expect to see just from who's living in poverty. So homelessness is disproportionately experienced by Black, Indigenous, and people of color. So Black people are 13% of the total population of the United States, but make up 26% of people living in poverty, but then a further 40% of people experiencing homelessness. That holds in a lot of different kinds of communities. I don't have the exact numbers for Dallas in front of me, but I would imagine it tends to track with that. And Indigenous people across the country are also significantly overrepresented among people experiencing homelessness. So that is some of the stuff we know to be true. We also know that the longer people experience homelessness, the more trauma they experience, the harder it is to get out of homelessness, the more just compounding negative impacts that homelessness has on that individual or that family. So we really want to end somebody's homelessness as quickly as possible. And we also know from experience, from data, from research, from hearing from people who have gone through these programs that short-term assistance that helps that person resolve that immediate crisis, it can be really effective in sort of kicking off and serving as the foundation for long-term success. So, and we see that most people are able to exit homelessness with just a little bit of short-term and intensive assistance. So if you go to the next slide, if we have that sort of mutual shared understanding that this is what homelessness looks like in our community, then that sort of says, okay, so then what do we do? How do we respond to this? And rapid rehousing is one of the main interventions that we have to respond to that. It's the one we're going to be focused on today. So just a little bit of baseline grounding. What is rapid rehousing? There's really three core components. And just above and beyond, rapid rehousing is what it says it is in its name, right? We are trying to quickly help somebody go from homelessness back into housing. We're trying to rehouse them, and we're trying to do it quickly. So that is really the ultimate goal. So in order to accomplish that goal, we help folks identify housing, provide rent and move-in financial assistance, and rapid rehousing case management and services. The pithier way to say that, you can see on the left side of your screen, find, pay, stay. Are sort of the three core components. I like the other graphic though too, because it sort of shows that these are not necessarily consecutive processes. These should not be siloed out. These are all things that may overlap. They should be working concurrently, working together. Because they're going to all impact each other. So that in order to be rapid rehousing, somebody should have access to all three of these services. They may not necessarily be utilizing all of them, though, right? Somebody may just need help finding housing, and then they're actually going to have some fund set aside that they can pay the security deposit and their rent on their own. It may be that they've already identified a unit, and what they really need is some financial assistance and some case management to maintain that unit. Most people are going to make some use of all three of these, but they all need to be available to folks, even though not necessarily the same person is going to be providing all three of those in the same organization, or people may not necessarily be utilizing all three. So if you go to the next slide, just some key concepts about the rapid rehousing approach and how we do this. It is a housing first intervention, so that means that we are providing services with no preconditions. They are able to serve everybody. They're very low barrier. We're not, putting a lot of qualifications on who can and cannot be assisted through this program. It is also a crisis response oriented approach. So again, as we mentioned, we want to do this as quickly as possible, and it's because we recognize that homelessness is a crisis. So we want to solve that as quickly as possible, and really be focused on that immediate need of resolving the housing crisis. So that's helping somebody find new housing, helping them stabilize in that housing. It may or may not solve every single challenge that this person is experiencing right now, but it's a crisis response focus on solving the immediate presenting needs right now. It's also about client choice, very closely tied to housing first. This is driven by the participants, where they want to live, what they're looking for in housing, what kinds of services they feel like are going to be valuable to them. So we're not the ones driving that. It's all, being driven by the client themselves. And it's a progressive assistance model. So the goal of this is really to provide the least amount of support needed to help that person exit homelessness, get back into permanent housing, and stabilize there. So there's, this is not like one uniform package of support where everybody gets the same thing. So some people might need a lot of support, might need a lot of hand holding, a lot of, driving them to an appointment, paying, a full 2 years of most of their rent. Others might just need, a little bit of cost to help them move in, maybe a month or two of rent, and they're going to be fine, and everything in between. So, these programs really need to be flexible to meet the needs of the folks as they're presenting. So whether that be a very little amount of assistance or quite intensive supports for a longer amount of time, within the regulations, as we're going to explore a little bit later, but they really should be a progressive model. And then the last thing I want to say here is just, I think it's going to, if you go to the next slide, Greg, I just could underscore some of what I already said, but maybe put it in a way that's a little easier to understand and manage. I just want to be really clear about, as we're looking into these regulations, as we're thinking about designing rapid rehousing programs and delivering rapid rehousing services, that we're just really clear about what we are trying to do here. And the things that rapid rehousing is not necessarily designed to do. Now, I don't want to say that the rapid rehousing shouldn't do these things, or that it wouldn't be good if rapid rehousing accomplished the things on the right-hand side of your screen, but that it's not necessarily in the design. So we may or may not be achieving those things. So we are in rapid rehousing trying to reduce the length of time people are homeless, so they're homeless for as short of amount of time as possible. We're trying to help them. The end point is always permanent housing. We are trying to help them exit homelessness, get back into their own permanent housing. By doing that, we are minimizing the impact of homelessness on their lives, less trauma, more consistent school attendance, better health outcomes, all the things that we know are associated with housing, and that homelessness can be detrimental towards. We do want to help people access the resources they need to solve some of those longer term goals. So it may be getting connected with doctors. It may be getting connected with mental health counseling. It may be getting connected with a job or with benefits or whatever. We can start all the wheels in motion there. That is a good and necessary part of rapid rehousing as well, so that we do help people, find, pay, and stay. The stay part and the case management is really important. It is not housing only. I just want to be really, really clear about that. It is not just a checkbook to help pay for people to get into housing. The services are critical. And ultimately, all of this is going to reduce the number of people experiencing homelessness in your community, because we're going to be able to serve a lot of people. We're going to be able to effectively rehouse them and end their experience of homelessness, rather than just sort of sheltering people for a while and hoping they figure it out on their own. So what rapid rehousing is not designed to do is it's not designed to end poverty. We know that, and to that second one, ensure people will have affordable housing or eliminate rent burden. As we talk about things like fair market rent and rent reasonableness later today, and as we're thinking about, finding housing, negotiating with landlords, ideally, we would love to see everybody have housing that they love, that they pay no more than 30% of their income for. I will not ask for a show of hands on this call, though, but I know that, given stagnant wages, given high housing costs, there are probably many of us on this call today who are spending more than 30% of our rent on income. We are not here to say that is okay. We are not here to excuse that or to say it's fine, to say it's not going to cause some instability or problems down the line. That said, it is the system that we are living under right now. It is the conditions we're living under, and we can't just have people experiencing homelessness waiting around for some mythical, 30% or less of their income apartment to come up. Many people are able to successfully stay housed, even with really high rent burdens. So that is probably going to be the reality for the vast majority of people that we're working with through rapid rehousing. So, to that degree, it's not going to protect people from all of the different kinds of things that may come up in their lives, whether it's, a job loss, whether it's housing market conditions changing, choices they make that we agree with, that they disagree with, whatever it may be. I think there's always concern about what's the long-term sustainability plan? What if this happens? What if that happens? And the answer is, we'll roll with that, right? We know that housing is the foundation for folks to be their best selves, to have the best health outcomes, be able to hold down a job, to be able to hold down relationships that, are beneficial to them. All of those things that help make our lives full and well, housing is really a foundational piece of. But there still will be challenges down the line, challenges that the person will face, and that may impact their housing again. So we may have to help this person again down the line. We're not going to be able to, again, solve for every problem that may arise in somebody's life, but we are helping give them the foundation to do that. And then the last piece here is eliminate housing mobility. Folks still may move in the future. This does not need to be, it's not going to be the last place that people live. So there may be some things that they love about this housing. There may be some things that they wish were different. That's fine. Again, we probably could all name things that we wish were different in our housing situation right now. So we work towards that, but this is our foundation for making that next move, for increasing our income, for finding a place that we like better, for finding a place that is in a better location for us. But this is kind of the first step. So then if you just go to my last slide for now, just want to make a note, and I can put some links to research things in there. I just want to make the note that this stuff is not theoretical that we're talking about either. Communities, your community's been doing it for a while. Many communities across the country have been doing it for a while, and it is achieving those things, right? We're not just sort of dreaming this up and saying, what if we did this? We are seeing that communities that are implementing rapid rehousing really well at a good scale with high fidelity to the best practices of the model are seeing people be homeless for shorter amounts of time. They're seeing rehousing costs go down, so you're able to serve more people, more households with the limited funds that you have. We are seeing that for the most part, the vast majority of people are staying housed. It's not 100% of people, but most people are able to maintain their housing even after that assistance ends. And again, as we do all of those things, our homeless systems become more efficient so that we're able to quickly connect people with what they need at the right scope of their needs so that we can serve more people and make sure that everybody who's experiencing homelessness in our communities right now has access to something that's going to help end their homelessness. So I think I just wanted to kind of give that grounding. So as we talk about what can sometimes be stale and boring regulatory language, we know that it's all to the purposes of serving this higher cause of ending homelessness. And that's why, we have some of these regs to help us do this well, to help us do this effectively. So, thank you for listening to me on that piece. I hope it was a helpful kind of grounding as we go into start talking about all right, so how do we do this in our community? So with that, I think, am I turning it to you, Sarah?
Yes, thank you, Ben. I get to do the stale and boring regulatory parts of this. Yes, Ben is great, and I always love when I have to go after Ben. So as Greg affectionately called me yesterday, the pencil pusher, I am here to talk to you more about how you can use either your ESG grant funds or your COC grant funds to help to administer rapid rehousing, as Ben said, around find, stay, pay, or pay, that. So we'll start off with ESG, the eligible costs for ESG. I just want to make note that for today's session, we're talking about ESG. We're not talking about the additional eligible costs or expenses that are, or items that are eligible under ESG CV with the CARES Act. This is just straight up ESG. Know that what we are saying for ESG in terms of these eligible costs, these are also eligible under the CARES Act as well. So I just want to lay that out there. So we want to distinguish, there are similarities, but the differences are kind of nuanced between ESG and COC. So it's really important as you administer the program that you have a clear understanding of what your funding source is, especially if you have both funding sources, because the way things are categorized and small nuances, there are small nuances between the two funding sources. So we will start off with ESG and the eligible costs. So at a high level, the way ESG categorizes their expenses are either rental assistance and housing relocation and stabilization services. Those are kind of the two components. And within the housing relocation and stabilization services, they break it down farther with financial assistance and then support and services. Often you would think of these as like supportive services. But again, high level, rental assistance, you're getting at that, helping someone pay their rent, that rent subsidy and rental arrears. The financial assistance is where there's flexibility around paying application fees, security deposits, utility deposits, et cetera. I'm not going to read everything on the slide. Just note that the total period that the person can receive rapid rehousing for ESG cannot exceed 24 months within a 3-year period. So that is specifically for ESG. The other thing I want to say, what we're talking about with eligible costs and some of the regulations, these are from the HUD's regulations, et cetera. There may be local, you make sure you look at your grant agreements, your contracts, et cetera. Things may be more restrictive, et cetera. So yes, so 3-year period, no more than 24 months and during any 3-year period. Just want to note, when we're talking about staff and overhead costs directly related to carrying out these activities, those get charged or expensed or reimbursed under these actual components. So the staffing that it takes and overhead that it takes to administer rental assistance would get expensed under rental assistance. It's not, that wouldn't be counted as admin or something like that. And I just want to, that's often a confusing point for a lot of communities and providers. Those are actual program costs. So next slide, please. So just when we break this down, when we talk about rental assistance, HUD really, the way they explain it is short term is 0 to 3 months, medium term is 4 to 24. Know that you can't provide any more than 24 months, you know, continuously. And then when we're talking about the rental arrears, that's a one-time payment for up to 6 months in arrears. Something to note, that 6 months then gets counted towards that 24-month limit. So if you're giving someone 6 months of rental assistance for rental arrears, then the rental assistance moving forward would only be eligible up to 18 months. So just keep that in mind as you're doing this. Next slide. So we're talking about the financial assistance. So this is where we're talking about the rental application fees, and something I want to make sure we're making clear that this is what HUD's saying is you can pay for these things when it's also required of any other person that would rent from a landlord. So if you know, we don't want to have situations where landlords are only charging rental application fees for people experiencing homelessness, or only charging, you know, up to 2 months security for people experiencing homelessness, right? So this is like run-of-the-mill general what a landlord may charge just within their day-to-day business practices. So rental application fees, security deposits, again, no more than 2 months rent. You can pay the last month's rent at the same time as the security deposit and the first month's rent. Again, that gets counted into that 24-month limit. Utility deposits, again, if they're required by the utility company for all of their customers, not just those experiencing homelessness. Your utility payments, up to 24 months, and you can do arrears with the 24 months, and that's per service. So, you know, gas, electric, water, etc. And then there's some moving costs there, truck rental, moving company, etc., and some storage up to 3 months of storage with moving costs. Next slide. And so the services, these services are eligible when they're necessary to help a person obtain or maintain housing. Okay, so again, to circle back to what Ben was talking about, really the purpose, the goal is to get people rehoused. We know we're not going to necessarily end poverty and all of those things that those in poverty often experience. So we want to make sure that any services that we're providing, they're based off of necessity to help a person obtain and maintain housing. So at a high level, again, this is just how HUD kind of categorizes and groups things. You know, talking about housing search and placement, housing stability, case management, mediation, legal services, and credit repair. And we'll talk a little bit about each of those. Next slide, please. So we're talking about housing search and placement. This is when that find, right? The find part of what Ben was talking about. So these are the services that are necessary to help people in locating, obtaining, and retaining, so it's the find and stay, permanent housing. And these are the activities that are eligible. So when thinking about your staff and your staff allocated to these grant programs, these are the activities that they can work on or work with participants on under ESGCV with housing search and placement. So again, of course, we want to take a look at what what their barriers, their needs, what their preferences are. Again, going back to Ben and participant choice and helping people find what works for them, you know, helping them develop that plan for finding housing, helping them with that search, like not just necessarily giving participants a list of, I've seen in communities where they'll say, here's three vacancies I know of, and that's the end of it. When we're talking about housing search, we know that there are some people that may need a little bit more assistance in housing search. That may mean you're actually going and looking at vacancies with them and talking with landlords with them and things like that. Again, that outreach and negotiation with the owners and landlords, there's that, you know, not leaving it up to the participant to just go and find their own housing. That's really a role of the rapid rehousing program. We all understand, I know, I just recently moved to a new unit, even within my same building, and I got a new lease. And I was like, whoa, what is all of this? So we know leases are complicated, and we don't want to just expect that the people that we're working with understand what they're saying. You know, there's a lot of legalese. You may need to help people, you know, do some translation of what does this mean on an everyday, you know, everyday, day in, day out, what it means to pay on time, what will happen if your rent is late. All of those kinds of things. So we talked about this a little later around inspections and habitability and reasonableness. Any staff time devoted to these activities would fall under this services, housing search and placement category around helping people obtain their utilities and those moving arrangements. So again, this is really just thinking about the staff time that's allowed to, a lot of this you'll see in staff and overhead, and then general tenant counseling. So next slide. So the housing stability case management, this is the stay part of it. A big part of this is the stay. And I just want to make note, when we're talking about these activities that are 1 through 8 that are listed under housing stability case management, those are eligible. They cannot exceed more than 30 days while a person is still experiencing homelessness and looking for housing. Once that person is housed, you can continue to provide these services. But I just want to, I think this is structured, I'm going to guess, to show that, or to help explain that this is the rapid part of it. Like, we all have limited staff time. If it's 30 days and we still don't have someone housed, our focus should be on the finding the housing part, and less on these other services and activities. So that's the rapid part of rapid rehousing, trying to get people housed as quickly as possible once they're enrolled in your program and you're working with them. So there's not a limit on how long it can, you can take to find the housing in HUD's perspective. But just know that you can only provide these services for up to 30 days while someone is still looking for housing. So just keep that in mind. Again, I'm not going to read this word for word, you'll get the slides, but in general, part of this is doing the evaluation to make sure, to see if someone's eligible for the ESG assistance. Oh, I'm sorry, I kept HP in there. This might be a recycled slide from another presentation I used for prevention. Doing that evaluation, helping getting people connected to other services and benefits, evaluating their progress, making those referrals to other providers. We know that rapid rehousing is not always all-encompassing. It's not always providing holistic services, and that's the point. It's to rapidly rehouse someone, to provide that housing, and make those connections to other community providers that provide other services. Developing that service plan, and then reevaluation. So if someone is still enrolled in the rapid rehousing program after a year, a reevaluation is required. So next slide. Mediation, again, not going to read this slide, but just know that here are additional services and costs that are eligible under ESG. Mediation with the landlords. Again, this is part of the stay part. Especially if there are issues between the landlord and the tenant, you can use ESG funds to help work that out. Legal services, when we're talking about that stay, like helping people to maintain their housing. Credit repair, again, we can't pay debts, but thinking through budgeting, money management, helping people understand their credit report, credit score, all of those kinds of things. So I am going to just take a quick pause because that's ESG in a nutshell. Again, that's high level, but just wanted to see, are there any questions about ESG costs in the chat?
None in the chat right now, but I'm wondering if anyone would like to come off mute and ask a question. Maybe we'll just pause here for a moment for that. All right, we can move on then.
All right, so next slide, please. So COC, so now we need our COC providers to wake up. No. So when we're talking about COC, again, similar but not completely the same activities are eligible under COC. The way COC divides it out, it's around rental assistance and supportive services. Those of you who have COC grants understand those budget line items. So under the rental assistance budget line item, these are the eligible costs that would fall under the rental assistance. So it's literally not just rental assistance. You can also provide those security deposits, the last month's rent, some vacancy payments, utility allowance, which we'll touch on a little bit later, and again, any of the staff and overhead costs. And then the supportive services, again, when when you're filling out your COC application under supportive services, I think under each of these, I haven't done a COC application in a couple of years, but I think under supportive services, there are each of these are listed out, and you have to explain, what the activities are, number of staff or whatever, and the amount for these. So again, staff and overhead costs directly related to providing these are eligible. Next slide. So I'm not going to go into the service details around the services. I think towards the end, we have resources, we have references of resources of one-pagers and all kinds of stuff. But I do want to talk a little bit more around rental assistance, because again, I have seen in some communities where they think it's just the rental assistance that's eligible. And sometimes you'll see some underspending and things like that. And what's happening is they're not actually using the COC money for everything that they can use it for. So again, up to 24 months I do want to note when we're talking about COC, ESG had the 24 months within any 3-year period. For COC, it doesn't have this kind of time period around that or lifetime cap or anything like that. Again, consult local policies and procedures that may vary, but the total period that any program participant can receive rental assistance cannot be more than 24 months. So what this means is someone could receive COC rental assistance for 24 months. You exit them out of the program. 6 months later, a year later, 8 months later, 9 months later, they're experiencing homelessness again. They are eligible to receive rent. They would be eligible for COC rapid rehousing assistance. Again, dependent upon local policies. But just know from a HUD perspective, there's not that caveat of within the 3-year period. Oh, great. Your local policies match this. That's great. So again, up to 24 months, security deposits equal to 2 months rent. You can pay that last month. There's some allowability of vacancy payments. We would want to consult the regs and all of that, but I believe it's like it's equal to 1 month's rent. So if someone were to move out, etc., and you're able to still pay for 1 month's rent for the vacancy, and then in hopes, thinking that you'd have a new person, you can, maintain that relationship with the landlord, and they then can slide a new person into that. Utility allowance for this has to do with any utilities that are not included in the rent. So if the utilities are included in the rent, of course, it's part of the rent. And then, of course, when we're talking about the staffing and overhead costs and the administration, so processing those rental payments, looking at their income, I know for COC, for rapid, it's dependent upon COC policy determining the amount of rent or amount of money a participant may be required to contribute to the rent. And the other big thing is housing, the inspections. So staff paid to do the housing inspections are also an eligible cost under rental assistance. So supportive services. Next slide. Again, I won't list out because there are a lot of them, but this is all, again, the intent is to help participants obtain and maintain housing. The supportive services can be provided for up to 6 months after the program participant exits. So if you're providing 12 months of rental assistance and they don't need any more rental assistance, you exit them, you can still provide up to 6 months of supportive services. When we talk about not only the salary and benefits of the staff in the program that are delivering the services, also remember or keep in mind that you can also contract. You can contract that out. If you may not have program staff doing housing inspections and you want to contract that out to someone else to do housing inspections, you can do that. Okay. Or if there's a particular, housing inspections under rental assistance. If there's a particular supportive services that your agency doesn't, isn't part of what your agency does, but the program participant you feel could really benefit from that service, you can contract that cost out and contract with another provider to provide that service. If the service is not in the interim rule, it is not eligible. So just keep that in mind. It's important. The resources we link towards the end will list out all of the supportive services. If it's not listed there, it's not eligible. Just be mindful of that. So I'm going to pause to see if there are any questions.
Yep, Sarah, I was going to say, I'm getting a lot of feedback. There's a question in the chat. Are utilities that are charged by the landlord but billed separately from the rent covered? Sewer or trash fee, same monthly amount.
Yes, it has to do with the utility allowance, and we will briefly touch on that later, but I will also be directing you to a HUD document that helps guide through those regulations.
Thank you.
Yeah, no problem. Any other questions? All right. Oh, yes, that's the notice. Ben and I were studying it a lot. So I'm going to kick it back over to Ben to talk about rent reasonableness.
All right. Cool. So rent reasonableness, you're doing these whether you're funded by COC or ESG, although there are different standards for the two. So if you are an ESG funded provider, and with the caveat that ESG CV and some waivers that are out there right now for the waivers expire tomorrow. And as far as I'm aware, are expiring tomorrow.
Not
Sarah's
for
shaking
CV.
her head.
Not for ESG.
Yeah, oh, right, sorry, not for CV. Yes, CV, those are still true until the end of September. I have not heard that waivers will be extended beyond tomorrow, but that said, who knows? But ones we're supposed to end in December, we're extended in January. So anyway, if you are functioning under just the annual ESG, you also have your units have to be below the FMR, the fair market rent as well. Rent reasonable is the standard for COC. Anyway, what is rent reasonable? Hopefully many of you on the call are already doing these calculations and you're familiar with this, but just in case you're not, as a quick overview, we're just really making sure that the rent, the unit that somebody is renting is comparable to other similar kinds of units in the community. And I think this can be helpful. The pushback on things like FMR sometimes is that, depending on what neighborhood a place is in, rents may be very different. You're working in a metro area, it might be that in city center, the rents are very different than in more, sort of suburban or even exurban areas. So this is kind of trying to account for that and also trying to account for the fact that the market shifts, right? And I think we've seen that especially this year, that what was a fair market rent in, when the last ones came out, whenever that was, probably March of 2021, that may look very different than the reality on the ground in your communities today. So anyway, that's kind of why we're doing this. So you're trying to find comparable units, taking into account, as this says, that you want to find if somebody's trying to rent a 1-bedroom, you want to find other 1-bedrooms. If they're renting a studio, you want to find other studios. If you're doing shared housing, you want to find other rooms for rent. Whatever it may look like, you're trying to find other units that are as comparable as possible. So, you want to look at the age, not necessarily trying to compare a brand new 1-bedroom apartment to one that was built in the 60s, in an older building. Not trying to necessarily compare one that's sort of that 1-bedroom with a den that's actually 1,600 square feet to the one that's kind of the little mini unit that is technically a 1-bedroom, but is 800 square feet. You're trying to find as comparable of units as possible, trying to find them in comparable geography. So you do that by trying to find other announcements, advertisements. I think back in the day, this was maybe going through the newspaper, seeing what else is out there advertising. That's not so much how we find these units today, right? Just before this, to make sure I was giving you proper information, because I made the mistake of telling a community one time, you can just go online and find hundreds of listings today. And actually in their community, they had very few on the resource that I use. But there's all different kinds of websites. Zumper is one. Zillow has units listed. There's one called Pad Mapper. A lot of these are just kind of bringing together different online listing platforms, whether it's Craigslist, Rent.com, there's all kinds of ways that people are posting online now. And a lot of these are really, really easy to do because many of those that I named, kind of put that onto a map. So you can say, all right, this is the unit we found. Let's just hover over that location on the map and see what else pops up as a place to rent right now. And you should be able to find your 3 comps very quickly there, just by looking in the same neighborhood as the person's trying to rent. So that's what you're trying to do. If you go to the next slide, there's a link, and I will try. Let me see if I can find it real quick, and put the checklist in there in the chat. There's not like a form that you have to use for this, but this is a form that HUD has put out, and I think most people have modeled their own forms on. You're just really documenting all this stuff. You're writing down how many bedrooms it has, the square footage, the year it was built, whether utilities are included or not is a big thing. You want to be comparing if one unit is including utilities and another is not. Those aren't necessarily comparable. So we'll talk a little bit about how to match that in just a second. But so that you want to write down the proposed unit, then you write down the 3 comps, you do the average of those 3 comps, and that gives you your rent reasonable amount for the unit that you're using in comparison. So if the rent is the same or less, then it's rent reasonable. If it's more than that, then it's not reasonable, and you're going to want to try and find a lower priced unit. You can also, like, if you're helping house somebody in, say, an apartment complex, that can be very easy to do comparables if you can just have the property owner or the management company verify on their letterhead that, like, this is the going rate for a studio or for a 1-bedroom in that complex. Then that's a pretty quick and easy way to check the box that this unit is reasonable rent for the neighborhood. I don't think I have much else I really need to say on that. If you go to the next slide, Greg, just so if utilities are not included in this, then you want to add a utility allowance as well. So if you're trying to rent a unit that's a 1-bedroom and does not include utilities, and the other comparables you're finding are all include utilities, then you're going to want to make sure that to calculate the gross rent, you are taking both the total amount of the rent that's listed, let's say, $1,200 a month, any fees that may be required to be in there, like an HOA fee or amenities fee kind of things. Late fees can't be included in that. Pet fees can't be included in that. But if there are other fees, and then a monthly utility allowance. So again, and that's determined by the public housing authority in your area. Again, Sarah's going to talk about that a little more in just a second. But let's say the rent is $200 or $1,200 a month. Your utility allowance is $1,200 a month. No other fees. Your gross rent is $1,400. So that's kind of what you're going to be using as the standard for your comparable units. That may include utilities in the rent. I don't think I have anything else to say on that. I'm imagining that if you've been doing this for a while, you've done these comparables already. If you have specific questions about how to do this or what it looks like in Dallas, I'm happy to give it my best shot. But I think I hope that it's relatively self-explanatory.
I have a question about that.
Yes.
Appropriate time. Yeah. So one thing I've been trying to, as I've been looking over our rent reasonableness forms again, I'm trying to understand like how to apply the utility allowance to create gross rent for the comps. So because I don't know much about these other apartment complexes I'm comparing them to. I'm only getting information online. And in order to calculate the utility allowance, I need to know specifics like, is the water heater run by gas or electric in order to be able to determine the utility allowance, because our PHA has different amounts for gas and electric water heaters. So I don't know how to get that unless I'm calling every comp and apartment complex to have them break that down. So I'm trying to figure out, like, if you can help me understand, like, how do we create comparable gross rents when it's hard, or do we just apply the same utility allowance from the target property across the comps, or what's the right way to do that?
That is a very good question. I mean, Greg or Sarah, if either of you have particular insight to add, please add it or correct me. So what I'll say too, I mean, so this gross rent piece that we're talking about, that form that I put the link to is like HUD's like recommended form. It's a sample. It's a suggestion. Like I will say, when I was a rapid rehousing provider, we encouraged case managers the ones finding the comps and doing it. We encouraged them to fill out as much as they could. But like the age of the unit, like when it was built, was not always clear. And to me, the most important thing is that piece of like, are utilities included or are they not? Like, is the size generally comparable or not? Like, I don't want to be comparing studios to one bedrooms. I don't want to be comparing studios to 3 bedrooms. Like that's kind of, we kind of go with the best available information that we have. And so that I have not heard about the utility allowance shifting based on like what kinds of like hardware people have in their homes. I don't know, Greg or Sarah, if either of you have examples of that you've heard before, but my hunch, my inclination would be to just sort of assume that the things that you don't know are otherwise equal, right? Like if one has gas heater and the other has electric heater, I don't know, right? And it might fluctuate based on like what gas costs are, right? Like last year, maybe I want to give you more money if you have a gas heater. Maybe this year I want to give you less. Like, I don't know. So my assumption would just be like, let's say that it's more of a blanket, like utilities are included or they're not. I don't think it would be necessary to do all of that investigation into the actual like type of heating or type of cooling. I don't know, Sarah, Greg, is there any, am I off base in suggesting that?
I don't think so. So I think a few things. One, we want to take a step back and just remember, like, we all are just trying to get people housed, right? And like a reasonable, and make sure we're not paying some outrageous amount for one unit and it's not comparable to other units in the area, right? So that landlords aren't like hiking up the price for their units that are going to get assistance from HUD, right? So, and the other thing I would say is, I don't know, some communities, and I don't know if Dallas has this, some communities, they have like a range of what would be, they would deem as reasonable. So in one community I worked with, the policy they developed is, as long as the unit that the participant wanted to look in or move into was not more than 10% above the average of the 3 comps, to them that was reasonable, right? So there should also be local policy around what the community determines is reasonable. Can it not be at more than the average of the 3 at all? Is there wiggle room around it? I think, we should, in the spirit of trying to get people housed and knowing that it's a really tight market, we should try to be as flexible as possible within the constraints of, like, we also should not be, renting to landlords that are trying to rip us off either. So I don't know if that really answered anything. So your internal policy has been that the rent cannot exceed the average of the 3 comps. Right. So
I'm not aware of if we have, I don't think we have a COC policy. I mean, MDHA can correct me if I'm wrong, but I don't think we have a community policy on reasonableness.
Well, and that's the only thing that I was going to add too, is that this feels like an opportunity for some collaboration between the providers and MDHA. So I think this is a good, piece of feedback of something that, you're trying to figure out. And to the extent that, MDHA and the provider community can work together to figure out what makes sense, as a community, I feel like that's a valuable, effort to try.
And to underscore Sarah's point as well around, like, we're trying to help people find we're helping to not try to find a good deal, but like make sure they're not getting like, you know, that landlords are charging a fair price based on like what the going rate is. And so one of the things I like about Rent Reasonable is, for lack of a better term, it's like a little squishier than like the FMR. You know, the FMR is just the number. The FMR is the number. HUD tells you what the number is. You know, it's either more or less than that. Rent Reasonable, you know, is a little bit dependent on what kind of comps you're pooling. And I'll be honest, like as our case managers were doing those comps, like you're not under any obligation to pick like the absolute lowest. You're really looking for what is reasonable, right? Like you don't have to pick like the 3 lowest possible rents you can find in that neighborhood, but be sure that you're picking the ones that are fair and that are reasonable for what you're seeing in the market right now. And like, shoot, also if you're seeing like way cheaper rents in the neighborhood than the one that you're trying to help somebody move into, like make sure you're talking to those landlords as well, and maybe helping people move into those cheaper units if and when possible. So I think that, yeah, I think this is Rent Reasonable has a little more spirit behind it rather than just kind of the strict letter of the law, which I think is good, but then can also like present these interesting regulatory challenges like you're raising. So thank you for raising that. And I hope if someone answers the question, happy to do any follow-up if need be.
Any other questions right now before we move along? We're doing pretty well on time, so if you have questions, please feel free to ask them.
I think we're back to Sarah for utilities.
All right. In thinking about this, I almost wish, I think I drew the short straw on this one, Ben. I should have taken reasonableness. All right, so we're going to talk about utilities. So utility allowance versus utility assistance. Okay, so first we're going to talk ESG. So this is where it's different. This is different between ESG and COC. So let's talk about ESG first. So when ESG is talking about utility allowance, that has to do with the rent reasonableness calculation and gross rent and all of that stuff, right? You can use ESG to pay the utility use assistance, no matter what that cost is. Whatever the actual cost incurred is, you can use ESG to pay that. So if the electric bill so I'm going to give really bad examples because my utilities are included in my rent, so I honestly have no idea how much utilities cost. So if an electric bill, I don't know what's an electric bill a month, 100? I have no idea. If it's $100, you can pay $100. If water, what's water, like 30? I don't know. Pay it. Like just pay it. Whatever the cost is, you're allowed to pay it. Don't worry about that allowance side of it. That's what I will say about ESG. Any questions around that? Oh, and I think, oh yes, Ben just put in the chat the notice that I'm about to talk about. So next slide. We talk about COC. It's a little more complex. This is where utility allowance comes in. So first, of course, if utilities are included in the rent, like they are in my personal life, right? You pay the rent and it is what it is, that's fine. So when they're not included in the rent, you can use rental assistance funds to pay them, but there's more complexity around it. It has to do with the utility allowance. The reason I'm not going to go into this a lot is because it also has to do with the amount a participant is required to contribute towards their rent. So I don't know if you have a standard around that. So in some communities, even for Rapid, they'll say 30% of income, or they'll say 50% required to pay 50% of the rent no matter what their income is, et cetera. It varies community by community. So just know that if a participant is required to pay a portion of their rent and utilities are not included in the rent, I highly encourage you to look at the HUD notice that we linked. Oh, no standard. Programs handle client. Okay. All right. So that makes it, we're not able to answer the question then, since it's dependent upon how each program handles rent contributions. So
it's probably,
if that was not as helpful or direct as you were hoping or needed it to be.
but it's probably a good plug there. And we had talked about this a little earlier as we were trying to decipher CPD notice 1711 that we've linked there, which is that, for us programmatically, but I think also for clients, frankly, for the few people we're serving, advocating for utilities to be included in rent makes a lot of people's lives a lot easier. So if you can do it, it's really great. It's, more predictable costs for the folks we're working with, because certainly the costs in December, January, February, when you may have really high heating bills, or in like June, July, August, when you may have really high electric bills for cooling, can be really astronomical and really destabilizing, when costs are that variable, that might be $400 one month and it might be $40 the next. That's hard for folks to manage. And so to the degree that you can get those included, it makes a lot of people's lives easier. It makes the regulations a little clearer. It makes people's costs a little more predictable. So that is always a nice thing to try and advocate for. It's not certainly a requirement of, landlords, it's not a requirement of you as programs, but it can make things quite a bit easier for everybody.
Now, you're absolutely right, Ben. And when you were talking earlier about many of us have paid more than 30% of our income, right? And thinking back, especially as I was first starting to work in the nonprofit field, right? I can't imagine, I'm really glad my utilities have always been included in my rent, because I can't imagine paying more than 30% of my income and not being able to predict fluctuating utility costs. So yeah, that's real.
And since we have a minute, I'm going to take some trainer prerogative and just make a little aside as well, which is that I train some of my folks up in the state of Maine, who I work with as their point of contact last week on shared housing. And in a shared house, here's my trainer prerogative, which is you all hopefully are helping people move into shared living situations, because if you're not, boy, again, we talked for an hour and a half up there about this week. We have 15 more minutes. I will not give you my full spiel, but the reality is, in a market in which costs are super, super high, vacancy rates are really, really, really tight. We need every single tool at our disposal, and really even pre-pandemic, what we've seen in the last year in terms of vacancy rates and rents, becoming just completely out of control. I'm sure your community has always experienced really low vacancy rates and really high rents in comparison to a lot of other communities as a major metro area. When I did this work, I was doing it in Washington, D.C., where we had always ridiculous rents. So shared housing also helps you really lower those costs. How this relates to utilities is, we also talk about that as a best practice in shared housing. And I can speak from personal experience too, where you're trying to split utilities, and different people like the house at different temperatures, and different people are better at reimbursing you for paying the utilities, and different people have more disposable income to front that money for utilities till the other person in the house reimburses you for them. All that to say, it makes those situations a lot less complicated as well. So both a PSA that you should be doing shared housing in Dallas, and also that including utilities and the rent as a best practice in that really important line of work as well. Wow. Yeah.
And It's you. You're up now.
Oh yeah, so I'll just stay unmuted and keep talking. All right, so the final piece is around inspections. Again, I'm assuming many of you are probably already doing this, so I'm not telling you anything you don't know, but for those of you who may be newer to this or just getting used to it or are interested in sort of the differences between these two funding sources, so ESG uses HUD's habitability standards. COC funded rapid rehousing units need to meet HUD's housing quality standards, or HQS. I'll put, I'm going to just talk now instead of going through my tabs, but I'll put that link in later. There's a really helpful, that link that's at the bottom of this slide includes in the appendix a table that just directly compares habitability and housing quality standards to each other. The reality is these are really similar. The HQS standards are quite a bit more specific and detailed. The habitability standards are a lot broader and more general, but the habitability does have a few, like 2 or 3 very specific fire safety codes. The HQS does not. So best practice around this is really to have sort of a standard form that meets both of these standards, and they're so similar. But if you're going to do it, oh, thanks, Sarah. If you're going to do it, you need to make sure that it includes those pieces of habitability around the fire safety. So just like really quick, the categories, and if you look at the that document names the like standards in the Federal Register that these fall under. They're under the same buckets of things. So they call them structure and materials. So that looks at like the walls, the ceilings, the roof. Is the building gonna keep standing? Space and security. So like, do you have access to a bedroom, a bathroom, a kitchen? Are there locks on the doors? Those kinds of things. Interior air quality is one of the areas. So that's looking at like, is there a window in each room? There's a few slight differences between HQS and like what it says. And again, habitability they're really broad. It will usually just give kind of like one sentence of a description, whereas the HQS standards are a little bit more checklisty. Like it'll list off like 4 or 5 bullets that it's got to meet, but it uses the same terminology and the same buckets. Water supply, it's got to have connection to clean, safe water. Sanitary facility, so you have to have access to a bathroom. It has to have hot and cold water. There's an area called thermal environment, so that's like your heating system. Specifically heating, cooling is usually not a requirement. If it is in the building, it needs to be maintained, but that's not necessarily a requirement that it has AC. Illumination and electricity, so that's like, does it have windows in the unit to provide natural light? There's some standards on like the kitchen, I think, has to have like a fixed light. There's some standards around outlets and the number of electrical outlets that have to be there. Food prep is really important. I just have had a lot of really nuanced questions about this surprisingly recently. I think as vacancy rates get dangerously low, landlords are cutting some corners and people are moving into units that don't have appliances. HQS and habitability require the languages. You have to have a way to store, prepare, and serve food. That means that you have to have some sort of refrigerator in the unit. There's a lot of nuances in terms of like whether that could be like a mini fridge or whether it has to be like a full fridge. There's a lot we could get into around that, and prepare, like, there's some units just providing things like microwaves or hot plates. The language does explicitly allow for that, but with the caveat that like kind of what Greg and Sarah were saying earlier, like it has to be in line with what other people are getting in the community. So like you can't take out the appliances for people who are homeless and give them a microwave while everybody else gets like a stove and oven, for a different rent. So anyway, that's all part of it. The fire safety pieces, ESG requires there be the habitability requires that there be a second means of egress and smoke detectors in common areas. The HQS regulations really only specify that there has to be one smoke detector per level of the building. So anyway, those are kind of the little differences. You can really get into all of them. I can put also in the chat HUD has a few examples of habitability checklists and HQS checklists on their website that you can use to sort of adapt. Again, I'm assuming you probably already have those forms in your community, so use those. But I think just to note around inspection, like you have to physically inspect each unit. That was waived for a while. I think as of like April 1st, that will be required again. For everybody. And even when you weren't like going, even under the waiver, you still had to have like pictures. You still had to complete these checklists and go and do it in person as soon as was practicable. So anyway, just to note that like you have to do this for every unit. They have to be inspected at least annually. So if you are providing support for somebody for more than a year in the same unit, you're going to have to go and do that again at month 12. If you're providing it for less than a year, don't worry about it. This does not need to be a certified inspector, right? You can be out doing this yourselves. And I think that's all I'll say about that for now. If you go to the next slide, I just pulled out specifically some ESG standards on habitability. I think I said most of this already, but it shows you where you can find the standards in the Federal Register. I think I just pulled out ESG specifically to note, we're talking about rapid rehousing today, but if you're providing prevention services under ESG, the habitability also holds for, like if you're paying arrears for somebody, you also have to make sure that unit is inspected. If the person is not planning to stay there and is looking for a new unit, then the standards would apply to the unit that they are finding, not the unit they're currently staying in. But if you are paying anything for that unit, it has to meet habitability standards, with the caveat that if they're moving into a new place and they need to have arrearages paid in order to move into the new place, but they're not living in the other one anymore, you can pay those arrearages. And it's applied. This note here, it applies even if you're just providing case management to that person, or like a security deposit, just one-time assistance. No matter what you're providing, there needs to be documentation of that habitability or housing quality HQS inspection in the file. So even if you're not like providing them with financial assistance and just case management support, you still have to. It's still an eligibility piece. I see there's a few questions coming in, so I think that's all. I think that's the only, if you even just want to go to the next slide, Greg, with resources, so folks can start to see them, we can put a few of them in the chat. I think that's the bulk of our like content that we're going to cover. So like if there are questions, things to come up, or Sarah, if you have anything to add to what I said about inspections.
No, I think so. I do see in the chat around using the HUD inspection for housing choice vouchers. Is that overkill? My understanding, and Ben, correct me if I'm wrong, for ESG, the habitability standards are not that complicated. It's pretty bare bones, right?
Yeah.
So I don't know if you would need to do like the housing choice voucher. I think I think housing choice voucher is HQS.
Housing choice voucher is HQS, and I'm going to put in the chat now the two links. This first one that I just put up is a sample habitability checklist. This is from a disaster rehousing program, but it doesn't really matter. It's all the same stuff. This is what HUD has on their website as an example. This one is 2 pages. It is so like who was it? Trudy said, like, if there's some providers that are feeling like really overwhelmed by this, like, I don't think this habitability screening it should feel too burdensome. It's pretty simple. The example from that HUD lists for HQS, like if you like Google it, is from the Office of Public and Indian Housing. So that is their like their like Section 8 or housing choice voucher checklist. It follows HQS standards. This one is intimidating. It like sort of breaks it down by room. So it's like, go to the living room and look at the electricity and check the windows in the living room, and then go to the bedroom and do that. I think realistically, you probably should be doing all of those things to like do it really well and really accurately. But I think that form, the one that I just linked to, that one's 8 pages. And so it does feel a little intimidating. I could see how it would feel really intimidating and like extra formal in comparison to that 2-page habitability checklist that feels a little more loosey-goosey. The standards are more or less the same. Like I said, like the HQS, I don't think it's overkill because again, the HQS really just like enumerates more specifically the things that are in the habitability checklist, but like it's not really adding anything new. But if it feels like an overwhelming form, the habitability form can be pretty simple.
Yeah. And I just put in the chat the habitability form that for ESG specifically.
Nice.
So it's there. They combined shelter and permanent housing. Obviously, for rapid, you'd only look at the permanent housing. In terms of the resources, I just want to say all of these resources are from HUD Exchange. Even us as TA providers utilize HUD Exchange. I use HUD Exchange every day, I think. So encourage you. We just popped a few on there. There are virtual binders. There's at a glance documents, 1-pagers. We know reading the regs can get overwhelming and confusing. If you're ever a little confused with some of it, still submit an AAQ. I highly recommend submitting AAQs. Not gonna lie, I had something. Oh, did I do that wrong? I'm sorry.
No, you're right. No, I'm just noting.
The one, I had something in here that I pulled from the virtual binder that I thought was eligible, and then in further research, it was eligible under permanent supportive housing, not rapid rehousing. So if you're ever, if there's any confusion, highly recommend submitting AAQs. AAQ responses are like your HUD endorsed response. So you can print out that response, put it in your program files so that when monitoring comes around or, something like that. So we just really encourage you to utilize the AAQ desk. I can't believe I'm saying this because I staff an AAQ desk. But I don't think the one that I'm talking about. So anyways, we have 3 minutes left. More than happy to answer any other questions.
I want to make one more quick note because I was just pulling up my slides and seeing that I did not say something that I meant to say around the habitability standards as well, which is that you can't use HUD funds like to get the thing about like the refrigerator that came up. Somebody's asking like, well, can we use HUD money to like buy a refrigerator for that person so that it meets those standards? The answer to that is complicated. It's mostly no. You can't use HUD funds to get a unit up to habitability. One of the good things about this current situation that we find ourselves in for like say the next 6 months with ESG CV is that there is a lot of funding out there for landlord incentives. And so while you cannot use those funds to get the unit up to habitability, what you can do is say, hey, landlord, here's a signing bonus. Here's, whatever it is, a couple $1,000. If you could get this unit so that we can rent it to you and you rent it to our client, that's yours. So that can be helpful and can sometimes work as an incentive, but you can't use HUD funds to get a unit up to habitability. Just as a note, I thought that was important because it does come up quite a bit.
Well, seeing that we only have a minute left, or less than a minute left now, I just wanted to thank everyone for coming. Wanted to thank MDHA for having us today. We appreciate all the questions that folks brought. I also wanted to thank Ben and Sarah. These two are national experts in the material that we presented today. And so, greatly appreciated their, contributions, having the time to meet with everyone today. I'm more of an HMIS guy, so one of the beauties of the regional teams initiative is that it's a way for us to bring other folks who are experts in other fields to meet the needs of communities. So thank you all so much for having us today. We appreciate all of your participation.
And Greg answers all of my HMIS questions.
All right. Well, if there's nothing else, take care, everyone.